Thank you, Dame Caroline, and it's a pleasure to serve under your chairmanship, and I'm glad to have the opportunity to contribute to this debate on the annual update from the government on its HIV action plan, and I thank the member for West Bromwich East for securing the debate. Having read the annual update, it is clear to see that progress has been made, but the plan has set the stage, for a transformative approach to prevention, testing, treatment and support. But, as ever, there is still room for improvement. And here the annual report highlights several key opportunities. First among them is a scope for improvement on access to HIV prevention drug PrEP, as we've discussed, HIV testing and care for people living with HIV. As the Member of Parliament for the Cities of London and Westminster, I know how important all this is. Reports show that Westminster has amongst the highest prevalence of HIV in the country, with 8 people living with HIV per 1,000, 15 to 59-year-olds in the area. But this action plan works to change these statistics, and the government's £20 million investment in opt-out HIV testing in emergency departments in areas classed by the UK Health Security Agency as having a very high HIV prevalence should be highly commended. As a result of additional funding, in St Mary's Hospital in my constituency alone, 3 people were newly diagnosed with HIV, 7 with hepatitis B and 14 with hepatitis C in the first 10 months of the government's programme. These figures from the first year of the programme have been broken down by the Terence Higgins Trust, with more than 2,000 positive diagnoses overall across London, Blackpool, Brighton and Manchester. Now we are in the second year of the programme, I think it is only right we consider the case for expanding the opt-out of testing. Indeed, I understand NHS England has costed and prepared the case for expanding HIV testing to 41 additional A&Es in areas with high prevalence of HIV, and I really do hope this is going to go ahead. Modelling by the Terence Higgins Trust shows that this expansion has serious merit to support the government's aims and ambitions. Also important to support the aims of the action plan is increasing equal access to PrEP, and we've heard in the debate today how important it is. This drug, we know, is revolutionary and has changed lives for so many, including many of my own friends. And I feel proud that my constituency is home to the outstanding 56 Dean Street, the sexual health clinic which pioneered PrEP in England. 56 Dean Street is recognised internationally for its innovation, particularly in regard to its engagement of London's higher risk communities. More than this, 56 Dean Street has been a haven for so many of the LGBT+ community over the decades, and I want to pay tribute to the outstanding staff who work there today and have done in the past. They have always operated without prejudice, even in the face of systematic discrimination. But looking at the PrEP situation, we do now understand that nearly 60% are waiting more than 12 weeks for their PrEP. And to this end, I'm glad to see that the annual report acknowledges the publication of the first National PrEP Monitoring and Evaluation Framework, but I think there's more to do. And the framework is clear that there are inequalities in who is able to access PrEP, and it needs to be really, really pushed on this. Now, the HIV Action Plan includes a commitment to develop a plan to expand access to PrEP, of course, through sexual health services, but I do think there is a case to be made to have it access through GP surgeries in particular, as well as pharmacies. And I think that we do really need to specifically ensure that we have equal access to PrEP if we are going to make our 2030 commitments. Dame Caroline, in the remaining time I have left today, I would like to take this opportunity to pay tribute to the work of the Terence Higgins Trust. From their policy to their fundraising efforts, they are second to none in their field. And in fact, I have been to visit their brilliant team in Boutique, the only Terence Higgins charity shop in the UK, and it happens to be based in Pimlico in my constituency, and they have just reached the £1 million charity money they raise for charity, and they've only done that recently, and I think this is utterly amazing. And I have to say, I pay tribute to all the volunteers who are working there. For nearly 15 years, the shop has helped the Terence Higgins Trust fund their hardship grant, services for people living with HIV, and its campaign to end new cases in 2030. So I will pay huge tribute to both the shop and to the Terence Higgins Trust. Madam Chairman, the government's HIV Action Plan is the first step to reinforcing the progress the UK has already achieved. Now, government, civil society, organisations, healthcare providers, researchers and communities must continue to work together to address the global challenge. By combining our knowledge, resources and expertise, we can develop innovative solutions, advocate for policy change and create a sustainable impact that will shape the future of HIV prevention and treatment.